Well, from Barcelona to Berlin, millions of people have been told to stay at home unless it's absolutely necessary to go out. So for those of us who do have to leave, how can we get safely from A to B? I asked Dr Richard Dawood, a travel medicine specialist.
Well, I think it's reassuring to know that most operators of transport systems have really upped their game in terms of hygiene and cleaning, deep cleaning. The airlines have announced this. Public health systems, certainly in London and elsewhere, have announced that they're upping their game. I think we are all becoming increasingly aware of the need to clean our hands after handling frequently touched and handled surfaces, handrails, escalator rails, lift buttons, things like that. There's no harm in touching all of these surfaces as long as one remembers where one's hands have been and uses a hand sanitizer or washes one's hands afterwards before touching anything else. Certainly, I have very few concerns about. A lot of people worry about the air in the aircraft cabin, for example, that is well filtered, and there's not been a single case of coronavirus attributed to taking an international flight, for example.
And when it comes to self-isolation, if someone is concerned about any symptoms that they're possibly showing, when should that come into action?
Well, so the focus is moving away from isolating people who've recently travelled towards encouraging people who have any symptoms whatsoever to stay at home and to avoid travelling or exposing anybody else to risk until their symptoms have gone away. So the focus is not so much on where you've been and where you've come from now as to whether or not you've got any symptoms.
And this idea of the borders closing down, we're seeing so many different countries shutting down their borders, a lot of concern. Is this effective in your opinion?
Well, there's been some very good mathematical modelling in the past on whether or not travel restrictions actually stop the spread of disease. And unfortunately, it's not, although it's a very visible measure and gives people a lot of a sense that something is being done, it doesn't really have a big impact on stopping the spread of disease. And this is particularly going to become even more the case as the rates of infection become uniform across borders. So it's much more important to focus on the way people move around and what they do within a country rather than whether they're coming in or not from abroad. That horse has already bolted. There are so many foci of infection now in many countries where coronavirus is now established that simply pulling up the drawbridge is not going to change very much, I'm afraid.